someone whose hope it is to embody to embody servant leadership, and she does that in everything that she does, with um, her continued participation in the community, whether it's, showing up to support someone's talk, showing up to support someone's events, or leading these events herself. This topic is very personal to her, as she has been impacted by brain health challenges as well as Alzheimer's disease. And she prays that this encourages someone to prioritize themselves a little bit more. And because, as she told me, a healthy you ensures a healthier journey for you and your loved one. So, ladies and gentlemen, I present Miss Stephanie Sylvain.
Thank you. You
You're
are amazing, Rashida, and I truly appreciate you. Hello, everyone on Facebook as well as here on Zoom. Thank you so much for joining, especially the board, because we're all ripping and running in different directions, but there's always support for one another. So I truly appreciate each and every one of you who are on this call, especially our founder, our board chair, our um, warrior of compassion and love in this world, Dr. Joanne Lewis. And so let's begin. So this month, there are different topics of awareness each month. And so, as she mentioned, we try our best to hone in on a particular topic of awareness to build the community, educate the community, but I would like to remind folks, some of us have nursing degrees or even doctorate degrees. I am not one of them. So I am sharing information that has been researched. I'm also sharing information as one day, maybe a doctor. Rashida shared with regard to a personal touch, and that's with regard to people in my family. But I'm also sharing because it's connected to this month. This month, one of the topics of awareness is Alzheimer's and brain health awareness. And so my theme, Alzheimer's disease through the lens of family, culture, and care. So my agenda includes an introduction, a discussion on the disease and how um, it and brain health can affect the body, the impact by culture, the reward and plight of caregivers, which is where the care portion comes from, next steps, and then a little bit more about JLF. However, I have to acknowledge Rashida just summarized everything so well that I will still hit the slide, but we have that information. So, Alzheimer's disease. Per the Mayo Clinic, it is a progressive brain disease that causes a slow decline in memory, thinking, and reasoning skills. And for those here, not only that are healthcare professionals, but just simply if you are an individual who has a loved one, a family friend who has experienced dementia, cognitive impairment, Alzheimer's disease, you recognize that those three categories, a decline in memory, thinking, and reasoning skills, is truly and also unfortunately the truth. So with Alzheimer's disease, and again, there's a lot of information here so that you can read along. I will not be reading everything on my slide, but I have the slide here. So whether you are someone who's a novice with this topic or or an expert, hopefully you will grab information and gather tidbits or be able to nod your head at what I'm saying as we share together. And so with the disease, the biggest thing for people to be aware of is an early symptom is the difficulty remembering newly learned information. So for those of you here, although it could be a symptom, if you start misplacing your keys, you don't automatically think, oh my goodness, I have dementia or Alzheimer's. But again, we'll see later that it's a symptom. But if there's new information that you've learned and you're struggling to retain it, that might be one indicator that you should look at. And because of that, it does disturb your daily life. Unfortunately, for some, we've seen people, and I say that because my background is social services and I work in healthcare, and you'll hear families during meetings share about how, oh, my dad was a pistol who was argumentative and rough and tough, and now it's weird to see this change in his personality where he's so calm and everything makes him cry. And then the the reversal can happen where we'll have people say that my mother never said a bad word. She thought it was inappropriate to say shut up, and now hearing her curse, it's like a different person. And so you're, for some people, they do experience a change in personality. And then just in general, communication and tasks throughout the day, something as simple as putting your clothes on, something as simple as having a conversation with a loved one by phone, something as simple as brushing your teeth can be a challenge. I remember going to a training where the speaker was explaining how, and this I think was one of his parents, he observed that the person literally said, I need to go to the restroom, and proceeded to get up, go up the steps to go to the restroom, and then got to the front of the door of the restroom and completely forgot why they were upstairs in the first place. And then unfortunately had an accident. And so what you'll learn is that part of the challenge with the daily life and the journey is that some people will struggle with things like incontinence, because they're, and the way he described it always stuck with me. He was just like, it's like your messages back and forth between you and your brain on what you should do, but there's a disconnect there. So the message may begin, but it doesn't fully reach where it needs to, so you can't fully complete the task. So more about Alzheimer's disease. It can be a confusion with time and place. I touched on that. And you'll see I put little messages, one to trigger me to share certain things with you that you may or may not know. So when it comes to confusion with time and place, it's one reason for the BIMS exam. So for people who are in healthcare, you know exactly what I'm talking about. For people who are not, um, you may not, but I'll share. BIM stands for a brief interview for mental status. And it's something that you'll notice if you go to the hospital, or definitely for people who work in facilities, where they do these exams or tests to see if you remember what year you're in, what today's date is, what and they do recall. So there are 3 words, sock, glue, and bed, that they share with you that they ask you to recall to see if you can remember. And it's not the sole indicator that you have cognitive impairment, or you're like on an early onset of dementia or Alzheimer's, but it can be one indicator or example and something to look at. Vision and spatial issues, calling all drivers. So when these challenges start to come about, this is when family members may say to certain people, hey, I don't know if she or he should still be driving that car. And or you get to a place where your doctor may say to you, hey, I think it's time that you stop driving, so we're going to submit paperwork for your license to be suspended because of safety issues. And ironically, my mother got into an accident and actually it wasn't an accident. She was hit by a car, and this was years ago. And, God bless the little old lady, but part of what she said crying when she got out the car was she didn't register how close she was to the sidewalk, because she hit my mom who had crossed the street and was literally on the sidewalk. So she was nowhere near her. And it was because she could not make that connection. And so we have to be careful for that. Language and communication problems, finding the right words. So one example can be like aphasia, where your mind knows what it wants to say, but when it comes to actually delivering your message properly, that can be a struggle. Poor judgment, show me the money. So unfortunately, another part of Alzheimer's disease, cognitive impairment, dementia, and brain health challenges is that you can get to a place where there's poor judgment. And because of that, you can be a person that is taken advantage of. And so we've seen a lot of cases with fraud, which is why our facility and a lot of organizations work with other organizations like Philadelphia Corporation of Aging, because we realize that people will try to take advantage. You'll have people calling, asking you to donate astronomical amounts of money. And when they see they can get $100 out of you, they ask for 200. And they play on the compassion and the trust of individuals, especially the elderly. Social withdrawal. Can I keep up? So what can happen for certain people, you have active people who loved interacting, whether it was going to church, going to parties, celebrations, and then you slowly see that they're disinterested in participating. And a lot of times it's not necessarily because, and most of the time it's not that they have stopped enjoying fun or like have changed the love that they have for their family, but while conversations are occurring, they don't feel like they can keep up. And so whether they're saying it or not, they're watching these different conversations occurring around them. But because they can't keep up, after a while, they slowly like internalize it and get more quiet, because they don't feel like they can be a part of that conversation. And that can be, embarrassing to some, especially when they're older. 6 point, misplacement of items. Where are my keys? So I touched on this earlier, right? That, unfortunately for some, it gets to a place where we start losing things and misplacing things. But again, if you just misplace your keys or your glasses and they could be on your head, like, do not run around just thinking, oh my goodness, what does this mean? But if you see more than 2 or 3 of these symptoms, you should start having a conversation with your doctor and those who are close to you to say, hey, have you noticed any changes in me? The last one, mood and personality changes. Why am I so nervous? Or like, why am I so moody? Why am I so angry? Why am I so short? These could be factors. The brain. So for those who, from a visual standpoint, need to see it, on one side you see a normal brain, and on the other you see a brain that has been impacted with Alzheimer's. And in that, one, it's not as full. Two, the coloring is different. So the synapses that should be shooting and moving, that has changed. Three, there are and bigger gaps and spaces where there should not be. And so that kind of connects to the discussion before about connecting the dots, having challenges where, you want to complete a task, but you start missing certain steps. And this is part of the reason why. Okay, so things to know. And again, I want to make sure that those who may be joining our call who are not really familiar with some of the healthcare information, are well aware after walking away from this call. So the biggest focus that I'm going to touch on is the fact that when it comes to diagnosing, excuse me, Alzheimer's and similar disease to it, the use of a patient's medical history is important. Their mental status tests are important. So I touched on already the BIMS, which again is the brief interview for mental status. There are other exams such as SLUMS that people will use, especially therapists, diagnostic tests. So there's blood work involved, and then brain imaging. And the main ones that can be used are the MRI, the CT, and the PET scan. And then there are other exams that may come up. So MRI, magnetic resonance imaging. And so that's where they use radio waves to get a 3D image of your brain. The CT is a scan that will use X-ray equipment, and it's more detailed in what it can see. And so your bones, blood vessels, the soft tissues in your body can be seen. And with that, they can see if there's a change in size, there's a change in the fullness, there's a change in, the girth, there's a change there. If there's evidence of any breakdowns or separation. And then we have the PET scan. And this one is very advanced. We're going to talk later about how the PET scan is actually one of the scans used when it comes to someone who's on certain medications to monitor and make sure that their blood and everything else is moving correctly. Additional things to know. So there's a breakdown when it comes to the disease progression. We have early stage or mild cognitive impairment, which, as you can see here, when a person is diagnosed, usually they say between 4 to 8 years, they live in this period. However, people can live much longer. I know for my maternal grandmother, when she was diagnosed, you know, I believe she was in like her 50s or 60s, and they at the time thought she would not live more than maybe 10 or 15 years. She passed away at 91. But Miss Fernandez was a tough cookie, and she always would say, I'm going to go when God calls me, and I think it's my time. But again, we're going with the statistics of what on average happens. The middle stage or moderate stage, this is when the symptoms can be more pronounced in people's communication, in people's forgetfulness, in people's change in personality. And because of that, that's why home safety assessments are beneficial. So for those who are listening who may already have this situation going on and or have loved ones that they know are going through it or neighbors, organizations, I'll say again, like Philadelphia Corporation of Aging, PCA, are very great because you can actually call their general number. And it's crazy, but I have a lot of these memorized by heart. 2157-659-000 or 9040. But they will come out and do home assessments and show you certain things you may need to adjust, lower for people who are going through this to make it easier for them when they're moving around, and also help them avoid accidents. Because when people are experiencing cognitive impairment, they have a higher likelihood of having accidents. And this is one of the reasons why they can become fall risk. Late stage or the severe stage. This is where people are not only having an increased propensity for accidents, more challenges when it comes to completing tasks, but they're more vulnerable and possibly prone to certain infections, including pneumonia, because they're not connecting the dots of if something is really wrong to react as quickly as someone would if they don't have cognitive impairment. And so this is where doctors would advise 24-hour supervision, especially if they have challenges like muscle weakness, lack of coordination, and other challenges. Okay, I want to make sure because I want to leave time for questions. So what else should you know? I said Alzheimer's disease, and some people will always talk about, like, is it the same as dementia? Is it different? So I wanted, for those who may have that question, it's a general term to describe the symptoms related to the mental decline of it. And when it comes to medications, we're going to touch on this a lot more later, but I just want to unfortunately share there is no cure. So when someone has been diagnosed with Alzheimer's, you know, currently there is no cure, but there are medications, especially if they're taking at early onset and it's discovered, that can assist with the process. And these are two of the medications that are not only involved, but also FDA approved. Outside of medications, and I say this because I always think it's important, no matter what the illness is, what the health crisis is, that medications and treatment are crucial and important and applicable. And that's the pharmacological approach. But there are non-pharmacological approaches that folks should consider, not just because you've been diagnosed with an illness, but just for your overall health. And so what do I mean by that? One of the things we've noticed is that when it comes to cognitive impairment, there's a restlessness and struggles with sleep, which is why, in addition to the BIMS exam, another exam that is taken is called the PHQ-9. And the PHQ-9 exam has to do with mood. So we're interviewing your mood and how you're doing. And so one of the things that can connect to mood changes or issues or irritability is sleep changes. And so one of the things I wanted to share in here from a non-pharmacological point, where like outside of the medicine, is that if you see changes in sleep, consider exercise. Because when you exercise, you hear about endorphins, and that it makes you happy. But also with exercises, because your muscles are moving, it will also kind of help you rest after you've done a good workout, taken a shower, possibly gotten something to eat, whether it's like a meal, a light snack, or a smoothie, and then gone to bed. Also, there's certain things to consider avoiding. So alcohol, like, we've heard maybe one glass of red wine can help with certain things, but too much of anything can be a problem. So alcohol is one thing that can impact certain people's sleep patterns. Caffeine, I know people who can drink coffee all day and say it doesn't do anything to me, but there are other people where caffeine does truly keep them up. And so if you're trying to get rest, a cup of coffee may not be the best thing, or something that's very caffeinated is not the best thing to take right before you want to go to sleep. Also, nicotine. Nicotine has been shown in certain cases to impact your sleep patterns negatively. Also, treating pain. So sometimes people are restless and unable to sleep because they're dealing with chronic pain or some form of pain, whether it's like chronic or single episodic that they need to deal with. And so if that's you, you should look at that. Things that could help you sleep. Melatonin can be a natural source, but for some people, they say melatonin does nothing to them. So I gave examples of sleeping pills, and in certain cases, atypical antipsychotics that could also possibly help, like risperidone. And again, that's also related if you're having some mood and other challenges. So doctors are not going to be prescribing that, if it doesn't relate and connect to whatever you're going through and or what may help you in the long run. Counseling. I know that in a lot of communities, particularly the immigrant community, and I touch on this, and part of the reason I wanted to talk about culture is because June is not simply Alzheimer's and Alzheimer's awareness and brain health awareness month, but it's also, Caribbean awareness month. And so certain cultures, it's taboo to consider counseling. Certain faiths, and when I say that, I don't mean that faith itself, because I do truly believe you can believe in God and have that faith and also have a counselor. That's why there's a number of Christian and other faith-based counselors out there. But I know it's taboo for certain cultures, but it can help certain people. And it's not only helpful for your emotional issues, but just that process of going through it all, the emotions, the highs and lows for you, if you're a caretaker, the person that's sick, going through it. I also wanted to touch on diet in the form of touching on diabetes. It is important that we're watching our sugar. I know last year when I did this topic, my focus was more on diabetes connected to Alzheimer's and dementia, but I wanted to keep a part of the diabetes chat in this presentation because it's not just a little sugar, baby. Sugar really can do a number on your entire body. And because your liver is what stores and makes the glucose, if your breakdown in your body is not going right, if you have uncontrolled sugars, it can be a serious thing. And it is a challenge whether it's type 1 or type 2. But type 2 is what most people are commonly diagnosed with and more familiar with. And so we need to be careful with our diet, especially with our sugary intake. The racial and cultural implications. So in reading an article related to the Alzheimer's Association, another amazing association that you should consider looking to support. They're going to have a walk later this year. I've walked in honor of my late maternal grandmother for the last 2 years with family or without, but with the cultural and racial implications, as you can see here, there there are statistics saying that for those who fall under white and non-Hispanic patients, there's going to be a continuous gradual decline of cases of Alzheimer's amongst that group. And those are the numbers from 87 to 67%. And so it took, a number of years, and it'll continue to take a number of years. But the fact is, at least we see a gradual decrease. Look now at the Hispanic population. At one point, when they were doing the review in the 90s to go to 2010, they saw in a lot of cases where they were doubling in cases, and then they're still expected that there will be an increase up until 2050. And then when you look at other groups, including our African American Black population, the numbers continue to steadily grow. And that's not just because I know some people could say, well, who are you referring to? African American, Black, which for some people are completely different. Some people are the same category. Do you mean those who are Haitian, Jamaican? Unfortunately, overall, the growth continues. And so we see this with type 2 diabetes. We see this with Alzheimer's. We also see this with hypertension, although it's not mentioned here. And we have to share the fact that when I say these different groups, there's also, information and evidence regarding American Indians, Asian Americans that are higher at risk. So we need to look at this. And let's touch on the correlation that I talked about before related to diet, particularly sugar or sugary drinks and all of that. 40 million Americans, so 12% of the United States, is living with diabetes. But the startling statistics reflect that 11 million of those individuals with diabetes are unaware and undiagnosed. So let that sink in. That we already know that there is an astronomical number of people who have diabetes, which can connect and link and cause challenges in other areas of your body, your mind, your journey. And on top of that 40 million, there's a percentage that don't even have any idea. They might have indicators, but they're not either interested in going to the doctor to learn the truth, and or because of other socioeconomic factors, they're not at a place where they can do it. And so with the diabetes on brain health and other parts of the body, and again, I want you to see the connection because we were talking about Alzheimer's and how it alters your brain. We were talking about Alzheimer's and we were talking about how there's an impact to spatial and visual, your spatial and visual self. We were talking about Alzheimer's and its impact to your thinking and your reasoning. And you look at diabetes on brain health. So that means if you're already concerned, if you already have a genetic predisposition for these things, and you're also struggling with things like diabetes, Alzheimer's is one of the key factors for somebody who's type 2 diabetic, who's diabetic and is type 2, that it can increase your risk of dementia. Diabetes also can cause you to be prone to depression or depressive episodes. It also causes foot damage. And I mentioned before, for people who have Alzheimer's and other cognitive impairment, one of the challenges that they have is accidents, which is why they require 24-hour supervision, because they get muscle weakness, lack of coordination, and things of that sort. Skin and mouth conditions, which is why oral health is important, and stuff like a scab, fungus, or for people who are diabetic and are not getting their feet checked by podiatrists, you really should. And then hearing. And if you can't hear, that's part of the reason why some people will socially withdraw from groups, because if they're not hearing, if they're not connecting the conversations, they feel like they're lost and not able to keep up. So what else would I want to tell you? From a cardiovascular standpoint, one of my best friends is a cardiologist, Dr. Villian, and it's a passion of hers, and it's something that I was always interested in, but I'm learning more through her. And just in general, diabetes can cause or result in a heart attack. And if you have a heart attack, if you have a stroke, that can lead to different forms of cognitive impairment. And some people with therapy and support and medications and other support can bounce back, and other people kind of go through this unfortunate spiral of other challenges. Eye damage. And if your eyes are damaged, that not only can impact, your movement, but it impacts and increases your likelihood again of falls. And if a fall results in you hitting your head, that could result in traumatic brain injury, which also is a form of cognitive impairment. So I've shared the correlation and I've shared about the different races, but let's look more into culture. And so for those who may have never heard of this phrase, the healthy immigrant effect. So what they've learned when it comes to diet, lifestyle, and one of the reasons why there's a higher likelihood of certain statistical probability for certain illnesses and diseases, whether it's diabetes, hypertension, Alzheimer's disease. Part of that is because when people are migrating into a different country and culture, they're not part of the baseline rates, but over time, because there's a change in their diet. So if in their country, even if it was poor, if they were used to only like grains, fruits, and vegetables, but now because they're in a country that is like richer or has more selections, they're eating a higher level of red meats, or they're eating a lot more fast food, or they're eating a lot more carb controlled diets. This can impact their health, and by impacting their health, it can result in these different illnesses. And so it's something to think about. And if you look at the statistics, 40 million are said to be living with diabetes in the US. 17% of those fall under or connect to foreign-born adults who are in the US. And again, the 11 million who don't even realize that they have it, that, and there's a line there, sorry, but it should be a point. 4.5% of those diagnosed reflect under that category. And so for the immigrant population, especially, and I touched on the second part already, healthcare access disparity is a big deal, whether it's language barriers, insurance, abilities to connect with the proper insurance or the best insurance. But also, one of the things that I've noticed in certain studies is the generational risk. So the generational risk, and I gave one example that when I was reading, I think it was the Yale Medicine article or under one of the other groups, and I have references later, but it was just saying for Mexican Americans, what they notice is if the diabetes continues to pass in a generation over multiple generations, the number of people who may have had it in the first generation versus the third generation almost doubles. The impact on caregivers, loved ones, and society. So, and this is not just true for Alzheimer's disease, but a lot of diseases that are plaguing our society. Stress is a danger, it's a challenge. That's why I mentioned a number of non-pharmacological suggestions, things that you can do, whether it's exercise, counseling, but also just what you're already doing. If you're faith-based and you go to a mass, you go to a church, interacting with people, fellowshipping has shown to do wonders and great things. Taking a walk, it doesn't have to necessarily be a strenuous exercise, although they do say it's good if it's high impact, for at least 30 minutes a day for a few times a day, if not 5 times a week. Mental health, addressing that. Physical health. Sometimes as caretakers, you're so focused on taking care of the person who's going through it that you neglect yourself. And by doing so, you find yourself in an unhealthy situation. The financial impact, it is very expensive, which is part of the reason why healthcare in some ways is, is unfortunately become a business, because there is an impact from the medications, especially if they're not covered, to all the medical appointments and the co-pays if you don't have a secondary insurance. And I was definitely advise people, as someone who's in social service who had to go through the system, not just for my clients, but also my own family, like, it is important that you recognize that if you're eligible for secondary insurance, you need to apply for it. Because, a doctor's appointment where, and for people who don't know, Medicare has an 80-20 rule. So 80% of your bill is covered by Medicare. That 20%, if it's $2, may not seem like anything, but if you are having a surgery for $2,000 or even more, then it adds up. And you're not thinking of like gas and transportation, especially if you're not a person who drives, it adds up. Strained relationships. When you're a caretaker, as much as your loved one appreciates the fact that you're caring for them and looking after them, they're also going to be annoyed, because at the end of the day, you remind them every day that the reason why you're there is because there are things that they previously were able to do that they're no longer able to do. And so it's a very painful experience for them and also for you. And so there is a beauty to having caregivers who are actual loved ones, relatives, children, spouses who can help. But sometimes you got to make sure you do wellness checks and have other supports for yourself, because as much as it's a beautiful thing if you're able to give back and take care of someone, it can be a very stressful stuff, a very stressful situation for you mentally, physically, emotionally, and everything else. And then isolation, for caretakers, sometimes there are a number of people who are coming together to take care of a loved one, but other times you may have one or two people doing everything themselves. And so that is very lonely, because you're missing out on family events, you're missing out on other activities. I want to go back with financial impact as well, because another part of that is just you may not be able to balance working a full-time job in addition to being a caretaker. That's why it's very helpful that there are organizations out there which you can connect with that will assist you, if you need to. So if you are somebody who's providing care, I would encourage you to not look at it and say, oh, I don't need to be paid for doing what I need to do. But if that caretaking task is taking you away from maintaining a job, you still have a livelihood. And so there are organizations out there that can assist you in doing that. 365 Health Services. You see of the other commercials, Homestead. I think another one is like Sweet Home. There's different organizations you can look into. Other tips for those who are giving care directly: ask for help. You might feel like no one's going to help you or they'll judge you because you need help, but then find another pool of people. But there are certain people that you should be able to ask for help, and I would encourage you to do that. Strong people need help as well. Build a support system, and that may be relatives, but it could also be friends, and that's okay. Talk about your concerns. You should talk about them with in certain cases, if you can, the one you're caring for, in certain cases, but definitely medical professionals. And then have patience. God gives us grace, and it's a beautiful thing. And so one of the toughest things is, and this is for me as well, like, being able to accept, you know, pray for grace, give other people grace, but it's not always easy to give yourself grace. And then keep track, journaling, documenting what's going on. So, especially when you're having these doctor's appointments, you can share them. You're not going to remember everything all the time. So, if you're taking notes and keeping a journal, it's helpful for you because it shows you, when you've had a bad day, but also when you've had a great one. Prevention is key. And so, some of these things I've touched on, and I want to leave an opportunity if people have questions or comments. So, you know, the best offense is the best defense is a great offense. Prevention helps before you have to deal with intervention. And so you see here the first thing I said, and if I have loved ones who are watching or on this call, which I probably do, they are probably smiling as I write these things because I'll be honest, I have to work on them myself as a caretaker and just someone who's in a helping field. But relax. Don't sweat the small stuff was a book I read. And I realized in a lot of ways, the things you think are the greatest, bigger things, this too shall pass, is what I want to encourage another person. So stress can really do a number on your body, your mind, and so your gut health. So please find ways to relax. Maybe it's a comedy show. Maybe it's a comical movie. Maybe it's just taking a nice bath. Maybe it's getting a massage, or maybe it's just a simple walk or prayer. Eat healthy foods. Fruits, vegetables are a great thing. Get more exercise and activity, which I touched on. This is one where a lot of us, and including myself, sometimes the love handles love me too much. But excess weight can be a challenge. I'm not saying that someone who immediately is 200 pounds means that they're unhealthy, because somebody could be 120 and they could be unhealthier than the person who's bigger. But it's more of
Stephanie?
um, treatments. And I'm wrapping up, folks. So
No, you,
treatment.
it looked like you paused for a little bit.
Oh,
You,
okay.
I think right after the someone could be unhealthy even if
Oh, yes. So just simply to say, when it comes to excess weight, we don't want you just to say because you're on the thicker side, because there's nothing wrong with that either. But you just want to make sure if there is an extreme excess of weight, try to adjust it even by 5 or 10%, because that can make a difference. And then sleep is important. Now for treatments. So there are a lot of other treatments out there. Again, those who are the true healthcare professionals, who are the doctors and the nurses and all of that on this line, could elaborate more. But I just wanted to give examples for folks on different medications that are out there that can assist with, managing Alzheimer's and cognitive impairment, helping with your quality of life. And in some cases, they've said it can slow the progression. So the first one, disease modifying therapies. I mentioned both of these medications before. I mentioned that they were FDA approved. I mentioned that PET scans are important because they need to monitor, how your body is circulating to make sure that there are not challenges there, and they're IV infusions. The next one is an inhibitor. And I broke down here the purpose, which is to help boost a chemical messenger responsible for memory, learning, and attention. So, one of the popular medications that people may be aware of, which is why I listed it, is Aricept. So, that can help for people who have mild to moderate stages of the disease. And then, last but not least, glutamate regulators. And so it's helping to regulate an overactive chemical messenger in the brain, that can damage nerve cells. And that damage to nerve cells is not is a medication that people can use, and this falls under the category of moderate to severe Alzheimer's disease, and it helps improve memory. The other thing that's helpful is that it can be paired with the inhibitor. And so these are just medications for you to consider. And with that, I want to thank you for participating. And I wanted to share and touch on certain things with regard to JLF. It has been an honor, privilege, and pleasure to be a part of the board. I started off working with the educational portion and became director of operations with tablets to keep them socially engaged. We were in the height of this, especially during COVID, when people were having to do virtual sessions and they could not be with their family. So we were trying to combat depression, amongst other things, the JLF closet, and so much more. And these are my references, including a study. Thank you.
Thank you, Stephanie. Thank you. What a wonderful presentation, very informative. Um, just even the way you tied all of the different diseases to brain health and how one can impact the other. I didn't even realize that generational diabetes could have such a huge effect, especially like doubling. So if
Mhm.
two people can then turn into four and eight and so on and so forth, that's a major impact on a family. And I know one thing that you really brought up was how even just the foods that we eat can affect our brain health
Yeah.
and the immigrant, well, what did you say? Immigrant,
Oh, yeah.
healthy
The healthy
immigrants?
immigrant effect.
Yes,
Mhm.
and I know just even like having spent more than a week in another country, eating the food there, I felt a lot healthier than when I came back to the US. And then there was just there was a lot of we have such an unhealthy diet here. So I can see how that can affect someone, coming from where they have natural foods and hardly any chemicals, if any, to our ultra processed food here in the US. So yes, this is wonderful. And thank you for the resources available. And
Absolutely.
yes. And the Alzheimer's Association, guys, is a great association to also involve yourself with. I happen to be a committee member of our local Palm Beach County walk
Awesome.
to end Alzheimer's. So hopefully there will be a cure one day. But
Yes.
let's open this up for questions. Does anyone have any questions for Stephanie? Okay. Well, I know Renee said, great job.
Thank you, love.
I do have a question. I
Yeah,
was to raise my hand and my screen was flipping on me. Sorry about that.
it's okay. Go ahead. Thank
um,
you.
so thank you for this presentation. It was very good. Um, I wanted to ask you a question about uh, younger individuals
Mhm.
who, as you say, if they're showing signs with forgetfulness, um, how can it be assessed whether they might have had undiagnosed attention deficit as
Oh,
opposed to a sign of Alzheimer's or dementia? What would be the key difference between those and how would they raise the flag?
okay. First, what's your name?
I'm Dr. G.
Dr. G, thank you for joining. I can't actually see in the image I'm in, so that's the reason why I'm asking. So first, thank you so much for joining. Thank you for asking the question. The teacher in me always says, for the one who asked the question, there's a bunch of other people thinking the same. So I would say, with regard to the exams, that's why you need to follow up with a medical professional and your doctor, and you also should probably start doing a journal. So if you're the young person journaling, or the parent of that young person, or a concerned neighbor who or family friend, there needs to be a journal on that, because as much as those different indicators, like managing money, reasoning, and forgetfulness could be cognitive impairment, as you said, with attention deficit disorder, that's part of the symptoms for that as well. So, I don't know the correlations, and I'll not touch on that. And if there's another healthcare professional, feel free. But I do know that when it comes to the different tests, that's the reason why stuff like the BIMS, the brief interview of mental status, would be taken. That's the reason why there would be labs taken, and that's the reason why they would do other exams, whether it's an MRI, to see if there's any brain damage, if there's any dysfunction there that, can't be seen by the visual eye. And that's the reason why that follow-up should occur. And they would also probably ask you, what about your medical history? So if you're a poor historian, you may not, or just someone who doesn't know connections to your family tree, then it may be difficult. But if you're familiar with, like, your history, like I know my history. So it's something we have a conversation about amongst my family. And again, I know from a cultural standpoint, because I'm not ashamed to say I'm Haitian American. And so some of these times I do remember, like, growing up at church, and I almost started speaking Creole, and that's not good. Well, it's not that it's good, but like, I want to focus on the majority here. But I remember hearing people telling my mom, "Pa fe moun kone," which in English is "don't let other people know." And so, because there's a judgment there, because even people realize from a generational standpoint, the generational cycles. If you're, a believer and you're active in churches, generational, they say generational curses, but curses and cycles, there's a connection with, they're just simply saying there are certain things that continue in different generations of your family that you need to monitor. But instead of hiding it and, it's important to discuss it and pay attention to it, because if you know in advance, you can look at that. And so those are the things that I would advise you, because unfortunately, people can get type 1 and type 2 diabetes at a young age. Traumatic brain injury can be a thing. And as someone who does, again, social services in the healthcare field facility, unfortunately, I've seen people as young as 18, and I've seen people as wise as elders who are like 103. I hope that helps.
Thanks, Steph. Just some comments from the chat. Great job, Steph. That's from Kimberly. Hey, Kim.
Nice to see. Hi, sister.
Amazing presentation, Steph, from Dr. Joanne Lewis.
Oh,
so, anything from the live stream?
I have a,
Oh,
I don't know if it's a question or a comment.
Hi,
Hi, Steph,
Nadine.
it's Nadine.
Now I know that, Sister Nadine. I know that voice.
Hi, yeah, that was very informative. But I do have I'm not sure if you know or about it, that Alzheimer's now is considered to be type 3 diabetes.
Correct.
Anything on that?
So I've heard it. It's funny you said it. I didn't put it in my presentation because I know there's been back and forth with that. But yes, there are certain specialists, certain studies that do say it's so progressive and it's so prominent that it is considered type 3 diabetes. And part of that is because of the increasing numbers, especially in minority groups, but also because there's such a strong correlation with Alzheimer's and diabetes. And so I mentioned some of the correlations, but there are unfortunately a lot more. The nerve cells, the Alzheimer's literally being one of the things they've noticed, where you're, because there's higher risk of all of these things if you have diabetes. And so one of the things I would say to people is, if you have it, please make sure you're controlling it. My family and I, my sister Kim, who's on the line, who's an amazing RN and educator, my other sister, we tag team together to care for one of the dearest people in our lives. And so we recognize that, I don't take for granted, we don't take for granted we have each other. Not everybody has that situation, but if you have diabetes in your family, you need to be attentive. If you have diabetes in general, things like, checking your blood sugar, before and after meals, is important. My mother wears a sensor, so we're able to monitor, like, during her fasting period, where her sugar spike and what foods can do that. The challenge with certain cultures, again, is that, like, some of those foods that are spiking, and again, it may not necessarily just be foods in general, but the foods that are available to you, but you have to monitor that. And for people who are nervous, get tested anyway, because if you get tested, and again, the medical professionals can elaborate more, but I know one of the major tests for diabetes is the A1C. So the A1C over a 3-month period, if not longer, but I know at least 3 months, will monitor like your sugar, like, you know, how your sugar in your body is processing. And so I believe if it's higher than like 6.57, or six or 6.1 or 6.5, something like that, you could be considered pre-diabetic. And if it's any higher, you're diabetic. And so if you're pre-diabetic, which you know, I've seen that, other family members have seen that, there's things you can naturally do to change that around. And so that's what you want to do. You want to get tested, especially if you fall under the 11 million who are undiagnosed, because the sooner you know, hopefully the better you can be more wise and more strategic and intentional about your approach. And so eating differently, like, you know, and sometimes it's not even just what you're eating, but where you're eating. Like for me, I work crazy hours. And so a lot of times it's in the evening when I'm finally been able to take a minute that I'm having, like, you know, my dinner. But if you're having dinner very late, like, you know, that's a heavy food that's sitting on you. And on top of that as well, if you're not sleeping, your body naturally burns calories, and your body REM sleep. And again, other people can elaborate more. I'm a little bit of a geekosaurus, so that's why some of the stuff I know or I like to read up on. But I know your body naturally resets when you sleep. And so because your body naturally resets when you sleep, it's not only beneficial to rest, like even the word of God, the Bible says Jesus rested on the seventh day. You need to allow yourself to rest. You need that time to sleep. And this was in the slide, but I think I might have gone too fast. But just so folks know, and I was like reading this myself, that, like, you know, it's important that you have at least 6 hours of sleep. And the recommendation is still, for most people, not everybody, most people have 7 to 9 hours of sleep. I know there are certain people who say, if I don't have 8 to 10 hours of sleep, my brain won't function. And you have other people to say, oh, if I have 3 to 4 hours, I'm fine. But a lack of sleep, especially a lack of sleep consistently, can impact your brain function, and that can lead to certain cognitive challenges in the long run. But the flip side is true as well. And I think that was the Mayo Clinic study or another study I read. If you're a person that's having 12 or more hours of sleep and you're saying, "Ooh, I just love sleep," that's not always healthy either. So you need to be getting up and moving. And the other thing is, if you're sleeping 12 or more hours, it could be an indicator that because you're struggling with chronic pain, you're trying to sleep it off. It could be an indicator of loneliness. It could be an indicator of depression. It could be an indicator of a side effect of your medication. For all of the benefits that these medications have, they also have some significant side effects. And so that's why you need to be very cautious. If you can tell, I'm very passionate. And with that, I'm going to stop.
No, that's really super informative. And I know we're a little over time, but
Yeah,
just even no, but even like
I'm
with,
here if there's anybody who still has
yeah,
questions, though.
there, like even with what you mentioned about medication. I noticed in your presentation how you mentioned like certain antipsychotics
Mm-hmm.
are able to help reduce Alzheimer's and
They can help with your
cognitive
sleep
decline.
changes.
Oh,
They can
sleep.
help with your
Okay.
sleep change. Yes.
Yeah, because I know from that, just from my own research, bipolar disorder, for instance, which is what those medications are typically used
Mm-hmm.
to treat,
Good point.
each episode can cause, can affect your brain health.
Yeah.
And with that, usually like with a manic episode, there is a lack of sleep. And then you
Mm-hmm.
flip to the other side where you're in depressive mode where you're just sleeping as well sometimes too.
Yes.
So it's interesting that you bring that up. So
Yeah. And I
so
want to say this with sleep. We understand that there are going to be moments in your life where you're not going to be consistently sleeping, right? So if you're a college student and you have exams, midterms, I remember we stayed up throughout the night till like 3, 4 in the morning, studying, drinking soda, and like, just to cram everything in. Or if you are a new parent, or people with young children, I remember reading studies, and that's why, as a proud auntie and godmother, I try to be as supportive as I can in my own family, because it is not a game out there. And I always say, for people who are parents, our amazing Renee, who's vice president, newly our new mom who has a beautiful baby boy who has joined the world, like her and her husband are not sleeping consistently. And the amount of the exhaustion that can happen with that. So we're not, that's a problem, but that's a period of time where you're going to lack sleep, but we're talking about if those factors are not involved and you're still not getting more than 3 to 4 hours of sleep, you need to be having a conversation with your doctor, because again, you need to give your body rest. You'll thank your body will thank you later if you do.
That's so true. Rest.
Mm-hmm.
The seventh day is there for a reason, y'all.
Yes.
Because even God had to rest.
Yeah.
So, do we have any other questions? Anything from the live stream? Okay. Well, just I know the time has come upon us, so
Yes.
yes, wonderful presentation again. Let's give a round of applause to, and I say she's incomparable because this is someone who really I've always looked up to her because she's just a go-getter and she's all,
make me cry on this live.
oh, don't cry because you're gonna make me cry and then we'll both be crying. And
Oh my
yeah.
gosh,
but yeah, you're just always, you're the first one to volunteer. You're the first one to, just want to make an impact in the community. And you've got so much on your plate and you're still doing more. So to you.
Well, thank you, love, and I'm so proud of you, and that's why I was very honored to have you be the one introduce and tag team with me tonight. And again, I and my sister who's on the call can sadly and truly tell you, my sister Kim, I struggle with remembering to prioritize myself while I'm doing everything else. But the more I manage things, and I'm a natural helper and all of that. I realize if you're not prioritizing you even just a little bit, you're not going to last long enough to be able to do all these wonderful things you want to do. And you're not going to enjoy that. And so we have to do better as a culture. We have to do better as a community, especially when stress is not just coming from our daily lives. But even if you look outside your door right now, my goodness, if you turn on the news right now with the different things that are going on, the vicarious trauma alone, which is like trauma, which is secondhand watching what other people are going through, it can add to your stress and you don't even realize it. So just be kind to yourself. Hold each other accountable. That's what I'm trying to do more, and just be more intentional. And it could be something as simple as, like, I know for me, when I wake up in the morning, I listen to a devotional and it's, like a godly song, an inspirational song. It's just my pickup. And so it just starts my day off before I have to do everything else. And so just do one kind thing for you while you're being kind to everyone else. And with that, I say, God bless and have a good night, everybody.
Good night, everyone. And just remember,
good night,
our
Steph.
Well
Great
Talks.
job.
Thank
Good
you.
night. Thank you.
Thank you. And remember, our Well Talks are every second Tuesday of the month. Next month will be on minority mental health for
Yes.
July. And follow our socials for more updates. All right. Have a good one, all. God bless.
Good night,
God bless you
everyone.
all. Have a good night. Blessings.
God bless you, Steph.